In this video, we are going to talk about the adrenal gland and how it is involved in the stress response. There are different hormones that are produced in the outer part of the adrenal gland called the adrenal cortex, and different hormones produced in the medulla, the inner part of the adrenal cortex. So let's have a look. The adrenal glands are located on top of the kidneys. The kidneys are located in the back of our abdominal cavity, so all of our digestive organs are in the front. And when we zoom in and look at the adrenal gland, we will see that there is an outer part called the cortex and an inner part called the medulla. The inner and the outer part of the adrenal gland are controlled in different ways. So the cortex is controlled by the pituitary gland hormone. So remember, the hypothalamus makes a hormone called corticotropin releasing hormone. That is going to stimulate the anterior pituitary gland to make adrenocorticotropic hormone, ACTH. This is the hormone that stimulates the adrenal cortex. And there are three hormones that are produced here that we're going to talk about. The adrenal medulla is controlled by the autonomic nervous system. Remember how the autonomic nervous system has a sympathetic response and a parasympathetic response. The sympathetic response is our stress response or our fight or flight response. So when the autonomic nervous system, the sympathetic neuron, preganglionic neuron, stimulates the adrenal medulla, it's going to produce primarily epinephrine, but also a little bit of norepinephrine. Okay, those are catecholamines that will have effects in the body like dilating blood vessels in the muscles, increasing heart rate, increasing cardiac output, dilating the bronchial tube so that we can increase respiratory rate. So those kinds of effects happen because of the sympathetic nervous system response. The adrenal cortex is divided into zones or regions. First, we have a connective tissue capsule that covers the whole outside of the adrenal gland. And then the first layer is called the zona glomerulosa. And in this region, we make hormones that are called mineralocorticoids. The primary hormone that we're going to look at is called aldosterone, and it plays a role in regulating sodium, potassium, and hydrogen ions. We're going to focus more on the sodium aspect. The middle region here is called the zona fasciculata, and its primary role is to produce cortisol or glucocorticoids. Glucocorticoids play an important role in regulating glucose. So cortisol is the main one we're going to focus on, and it has a lot of different effects, but one of the primary things is to regulate blood sugar. And then our third layer here is called the zona reticularis, and this produces androgens. And the main androgen here that we're going to focus on is called DHEA, or dehydroepiandrosterone, which is a precursor to testosterone, which is another androgen. And this is made in males and females, and we will look at that in a second. And then the very inner part here, this is our medulla. Primarily, this is going to make epinephrine, about 80%. Of the catecholamines released from the medulla are epinephrine, and about 20% is norepinephrine. These have those sympathetic nervous system responses that we just talked about. So let's look at aldosterone first. It is the main mineral corticoid that I want to look at, and it plays a very important role in regulating blood pressure. So in the kidneys are our main organ that will excrete water and ions and waste products, and then it will also reabsorb important things that it needs to keep in the body. So when aldosterone is produced, it will tell the kidney to reabsorb sodium. Now, what happens to water if we reabsorb sodium? Will water follow the sodium, or will water be excreted? Okay, water will be attracted to the positively charged sodium ions. Okay, so osmosis occurs because water is attracted to polar and charged molecules. So when we tell the kidney to reabsorb sodium, then we also reabsorb water. So then what will happen to our blood pressure? Will aldosterone make our blood pressure go up or down? Okay, it will increase it. If we reabsorb sodium and water, our blood pressure will go up. Okay, aldosterone also tells the kidney to excrete potassium and hydrogen ions. Hydrogen ions play an important role in our blood pH. So when we excrete hydrogen ions, that is going to make our blood pH go up. Okay, so low pH is acidic, increased pH is more alkaline. Why is aldosterone made? So what would cause the production of aldosterone? Okay, so there are two things. One, we've talked about our anterior pituitary produces adrenocorticotropic hormone. Okay, but we also have another whole system related to kidney function that regulates our blood pressure. So when our blood pressure is low, or when we need to increase our blood pressure, like during stress or exercise, then we will make aldosterone. So that molecule that can stimulate the aldosterone production is called angiotensin 2. So DHEA. This is a weaker androgen than testosterone, but it has similar effects as testosterone in both males and females. So DHEA can be used as a precursor to produce testosterone. And then testosterone can be converted into estrogen. So more testosterone will be converted into estrogen in females because females have aromatase, which is an enzyme that converts testosterone into estrogen. So DHEA has important functions related to secondary sex characteristics. Okay, so sweat glands and increased hair growth and muscle development. And it also plays a role in sex drive. So DHEA is important in both males and females, and particularly in females after menopause when the gonads are making less steroid hormones. So DHEA is stimulated, we produce more of it in the adrenal cortex when we are exercising or when we have a stress response. So exercise will increase the production of DHEA. And lastly, we increase DHEA production during periods of time when we have low calorie intake. And then our last adrenal gland hormone that I want to talk about is cortisol. Cortisol is a major stress hormone produced during stress responses, during acute stress or short-term stress, but also chronic or long-term stress. So now when we have these effects of cortisol, they're all very beneficial in the short term. When we have a short-term stress, we want these things to happen. But as I go through the functions of cortisol, I want you to think about how good would it be for these effects to be occurring on a chronic basis, okay? So one of the first functions of cortisol is to increase blood sugar. Cortisol helps us deal with stress by increasing blood sugar so that we can make energy so that we can deal with the stress. So it will tell the liver to increase gluconeogenesis, which is the production of sugar from molecules like fat or amino acids. So cortisol helps us to metabolize fat, protein, and carbohydrates. Cortisol, think of cortisol as a breaking down hormone. Okay, whereas insulin, for example, is a building hormone. Insulin tells us to build fat and to store glycogen. So cortisol does the opposite. It tells us to break things down. And we need this when we have a stress response. Okay, cortisol will also break down protein, like your muscles. Okay, in a very short-term situation, that is beneficial because energy is more important than having muscle mass. But what would happen if we did that for a long period of time? Okay, the other thing that cortisol does is it plays a role in increasing blood pressure as well. And it does this by causing vasoconstriction. Extreme amounts of cortisol can cause a redistribution of body fat. So cortisol can tell the body to store more fat in the abdominal region in your viscera or surrounding your visceral organs. which is a risk factor for heart disease. Okay, we normally have fat under our skin. This is our subcutaneous layer. Okay, that's a healthy place to have a little extra fat so that we have stored energy. But if you store too much extra fat in your abdomen, then that is going to contribute to heart disease risk factors. So cortisol can cause a redistribution of body fat from your extremities to your abdomen or your belly. So if you have a lot of extra belly fat and you have a lot of extra stress, there may be a correlation there. Okay, the other thing that cortisol does is it affects the immune system. So when we have a stress response, our body has to allocate our energy towards dealing with the stress response. And fighting infections will take a secondary role. We will put more energy into a stress response than we will into immune functions. The other thing that happens when we have an infection, sometimes the immune system can overreact. And cortisol will be released to help prevent our immune system from overreacting. So it's beneficial in the short term. Okay, but what would happen to your immune function if you secreted high amounts of cortisol all the time, right? Then you're always going to be kind of decreasing your immune function. Sometimes cortisol-like molecules, like cortisone, can be used specifically as a drug to decrease immune function. So cortisone cream, for example, can be used to decrease the inflammatory response of, say, an inflammatory skin condition like dermatitis. And glucocorticoids in general will all inhibit the immune response, and they can be used to treat diseases like autoimmune diseases where the immune system is overreacting. And then lastly, cortisol has an impact on bones. So when we have to have a sympathetic nervous system response, our muscles have to contract, our heart increases contracting, we need to have a lot of calcium in the blood for the nervous system and for the muscles to function properly. So cortisol will stimulate the osteoclasts in the bones to release minerals like calcium, so that we have more calcium in the blood for the nervous system and the muscles to function. But again, what would happen if that occurred on a long-term basis? What disease could you become more prone to if cortisol was always stimulating the osteoclast to release minerals? Okay, we'll talk about that in a second, so think about that. The last thing is that cortisol will inhibit the production of some proteins, and a very important and the most abundant protein in our body is called collagen. And we need collagen to heal our tissues. Collagen is the protein that will form scar tissue. It's also important for making your skin strong, your joints, your connective tissues like tendons and ligaments. So if you have excess cortisol, you're going to have a reduced ability to produce collagen. Okay, so now let's look at what happens if you have too much cortisol, and we'll look at an extreme situation where someone has Cushing's disease. When we look at the effects of excess cortisol, you can see that it's connected with what their normal functions are, except now, on a chronic level, having high blood sugar can increase the risk of diabetes. Having high blood pressure can increase the risk of hypertension. Cortisol is a breakdown protein, so it breaks down, it helps metabolize fat, carbohydrates, and protein, including muscle. So it can lead to loss of muscle mass and muscle weakness, and it will also stimulate osteoclasts to release minerals, which can increase the risk of osteoporosis. And it causes a redistribution of body fat so that more fat is stored in the visceral area or the belly region compared to the limbs. And people that have Cushing's or take glucocorticoid medications can have an increase in fat deposited in the upper back region called a buffalo hump, and sometimes they form like a moon face. Cortisol inhibits the immune response. So long term, this would increase the risk of infections. Because of its effect on reducing collagen production, it makes wound healing more difficult and skin will become thin. Also, having high blood sugar damages blood vessels, which also contributes to poor wound healing. This is why people with diabetes tend to have issues with healing skin wounds. And lastly, cortisol impacts the brain. It can increase depression and mood disorders, and it decreases your cognitive functions because during an acute stress response, it's beneficial to react quickly, and thinking can take up a lot of time. So cortisol reduces that, which is only beneficial for a short-term acute stress response. So if you've ever had the experience of blanking on an exam, that is a real thing, and that is caused by cortisol. I also want to point out that people that take a glucocorticoid medication for a long period of time to treat some autoimmune disease, let's say rheumatoid arthritis, they could end up with these symptoms as well. And on a milder level, if you just simply have huge amounts of stress for a long period of time, you will start to see some of these effects of excess cortisol. Now, what would happen if you had too little cortisol? So remember, every hormone needs to be balanced. We have to have the right amount at the right time for the physiological situation. So we want to have cortisol when we're having a stress response, and then we want cortisol to decrease. But we need to have a range of that hormone so that everything is always functioning properly. Too much or too little of any hormone will cause symptoms. So what happens if you don't have enough? There is a disease called Addison's disease, and this is an autoimmune disease where the immune system attacks the adrenal cortex. When the immune system attacks the adrenal cortex, it can impact all of the adrenal cortex hormones. So that includes aldosterone, cortisol, and DHEA. So the effects can be very diverse, and different people would have different symptoms depending on which part of the adrenal cortex is the most affected. So if we just look briefly at some symptoms, think about the functions of cortisol. Okay, we know what it does. Now try to think about what could happen if you don't have enough. What would somebody with Addison's disease, what could their symptoms be? Okay, so they would have an impact on blood sugar. Okay, so they would have hypoglycemia. Hypoglycemia is low blood sugar because cortisol helps to increase blood sugar. They would have low blood pressure. There's two reasons for this. One is the effect on cortisol not being able to cause vasoconstriction. And the other effect is because of aldosterone that tells the kidneys to reabsorb sodium and then water, which increases blood pressure. So people with Addison's disease would have low blood pressure. They would feel weak, maybe fainting, orthostatic hypotension, which is when you're sitting and then you stand up and you feel really dizzy. Okay, so any of those blood pressure kind of effects could occur. So hyponatremia is what we call low blood sodium. And if we don't have enough sodium, then because of the impact of how sodium affects the charge of cells, and how it affects action potentials in the brain and the nervous system and the muscles. There are a lot of effects that can happen from low sodium, and they can range in severity from feeling dizzy and craving salty food to having convulsions. Having low sodium can cause a bunch of different effects, and that even includes headaches and nausea, gastrointestinal effects, and cognitive effects like affecting your mood and your ability to think and concentrate and learn. The last thing that is interesting is when you have low cortisol levels, your anterior pituitary and your hypothalamus are going to try to increase the cortisol. So then what's going to happen is your hypothalamus will increase CRH, the pituitary will increase ACTH, and then that increase in ACTH is going to have a bunch of effects as well. One cool effect is that it actually stimulates melanocytes. So it will affect skin pigmentation. Melanocytes are the cells that give you a tan when you have UV light exposure. So increased or decreased cortisol to an extreme is going to cause symptoms. Now, the last thing that I want to mention about cortisol is that it actually has a 24-hour cycle of secretion. We make more cortisol in the morning and less cortisol later in the day, late afternoon, evening. So depending on your sleeping pattern, this is assuming that you sleep at night and wake up in the morning. So somewhere around 4 to 6 a.m., your cortisol levels are normally going to start increasing. And this is beneficial because it helps you to increase blood sugar while you've been fasting all night while you've been sleeping. So this increase in cortisol in the morning helps you to increase your blood sugar in the morning. And then we have a peak of cortisol release somewhere around mid to late morning. And then it's going to start decreasing in the afternoon, and it will be the lowest at nighttime. Now, if you have extreme stress, you can double the amount of cortisol that's produced. And if it's a short-term stress response, it's beneficial. If you have chronic stress and you're always sort of maintaining these high cortisol levels, then you could start to feel some symptoms of that. So the hormones produced by the adrenal gland, okay, think about the adrenal cortex and the adrenal medulla, and here is a summary chart.